Tetanus is an infection caused by a bacteria in the environment that affects the brain and nervous system that causes the muscles to clench up. There are many distinct symptoms of tetanus, including jaw cramping, sudden involuntary muscle tightening or muscle spasms, often in the stomach, and painful muscle stiffness all over the body, trouble swallowing, jerking or staring, which are seizures, headache, fever and sweating, changes in blood pressure, and a fast heart rate. These symptoms can show up between 3 to 21 days following infection and can last for many months. Tetanus is extremely serious and can lead to a number of complications like uncontrolled and involuntary tightening of the vocal cords, breaking of bones, infections received by a patient during a hospital visit, blockage of the main artery of the lungs or one of the branches by a blood clot that's traveled from elsewhere in the body through the bloodstream, or pulmonary embolism, pneumonia, a lung infection, and breathing difficulty, possibly leading to death. 1 to 2 in every 10 cases are fatal. Tetanus is caused by the bacteria Clostridium tetani that produces a toxin that affects the brain and nervous system. Spores of it are found everywhere in the environment in places like dust, dirt, and manure. Hippocrates first described tetanus in the 5th century BC, but the cause wasn't determined until 1884 by Antonio Carl and Giorgio Ratone at the University of Turin. And then this is a graph of the tetanus cases in the United States between 1947 and 2004. And so there were almost 600 cases in 1950, and then it gradually declined to less than 100 by the 1990s. This disease is usually transmitted through wounds by infected objects, and certain breaks in the skin are more likely to transmit the disease. Common ways tetanus is contracted is through wounds contaminated by dirt, poop, or spit. Wounds caused by puncturing of the skin by objects like nails or needles, burns, crash injuries, or injuries with dead tissue are also more likely. Other rare ways that one can contract tetanus is through insect bites, dental infections, surgical procedures, and compound fractures. Tetanus can live anywhere in the world, and though no one person is more susceptible than others, people who work outside and with machinery are at a higher risk of having tetanus. Vaccination is the best way to prevent the transmission of tetanus. This vaccine was developed in 1924 and remains to be the most effective form of prevention. Good wound care can also prevent the infection of tetanus. Never delay basic first aid. Wash your hands, and if you need to, you can consult your doctor. If you do end up with tetanus, your doctor may give you a tetanus antitoxin, but it only affects the amount of toxin that hasn't yet bonded with nervous tissue. Antibiotics are also an option because they can help fight the bacteria. Leprosy is an infection that affects the nerves, skin, eyes, and lining of the nose. It can be cured with early diagnosis, and those infected can still work and live normally during and after treatment. There are many symptoms of leprosy, including discolored patches of skin, usually flat, that may be numb or look faded or lighter than the skin around, growths or nodules on the skin, thick, stiff, or dry skin, painless ulcers on the soles of the feet, painless swelling or lumps of the face or earlobes, loss of eyebrows or eyelashes, and numbness of the affected areas of skin. The bacteria that causes leprosy is Mycobacterium leprae. It can lead to nerve damage, but most infections are limited to the skin. This rod-shaped bacteria was discovered by and named after Armour Hansen, which is why the disease is also known as Hansen's disease. The only way you can get leprosy is through prolonged close contact with an infected person. You cannot become infected through activities like shaking hands or hugging, sitting next to someone who has the disease on the bus, or sitting by someone during a meal. You can receive it, though, through droplets of wet matter from your mouth or nose, and again, only if you spend prolonged amounts of time closely with the person. Leprosy, again, can be found all over the world, but the oldest fears of leprosy came from ancient civilizations of the Chinese, Egyptians, and Indians, who thought the disease was incurable and extremely contagious. The best and almost only way to prevent contracting leprosy is through early diagnosis and treatment of people with the disease in order to prevent the spreading of it. The most effective treatment includes multi-drug therapy, which has been standard in treating leprosy by the World Health Organization since 1981. And then African, that word, trypanosomiasis, is known as the sleeping sickness and is transmitted by the tsetse fly. It's a protozoan disease. Usually within 1 to 3 weeks of a bite by a tsetse fly, the bite becomes a sore. Then fever, rash, swelling of the face and hands, headaches, fatigue, aching muscles and joints, itching skin, and swollen lymph nodes begin to appear. As the course of the illness goes on, the infected victim experiences weight loss. After the disease has infected the central nervous system, confusion and neurological damage can occur. It's caused by a microscopic parasite of the species Trypanosoma brucei, which is carried by the tsetse fly. British colonial surgeon Robert Michael Ford made the first major observations with this disease in 1901 while examining a steamboat captain. It was a major breakthrough for the disease. As I stated before, this disease is transferred via the bite of the tsetse fly. This fly is mostly found in the East African savanna. Anyone who gets bitten has an equal chance of getting the disease, but obviously only the people living and working in the area have the chance of getting bitten, but travelers can also get bitten. Since there are no vaccines for this disease, the only way to prevent getting bit by this fly is to limit your contact with any and all of them if possible. So stay away from East Africa, guys. Since there's no vaccines for this disease, the only way to prevent it, I just said that, never mind. Everyone who gets this disease has to receive treatment, otherwise the infection is usually fatal. Pentamidine, ceramin, melarsoprol, eflornithine, and nifurtimox are all common types of medicine that are prescribed based on the severity of the infection and what stage it's at.